All right, we'd like to welcome you to the February installment of the Kansas 4-H Animal Science webinar series. We are trying something a little different this month, and we are releasing a pre-recorded webinar. This month, we're going to focus on the basics of cattle health, and this will be certainly appropriate for our 4-H members who are enrolled in both the market and the breeding beef projects. With us today is Dr. AJ Tarpoff with K-State Research and Extension. He's our beef extension veterinarian, and I'm going to go ahead and mute and turn it over to him.
Well, thank you very much for the introduction. And yes, today we're going to talk a little bit about some basics of cattle health and care. We'll go through a little bit on some of our preventive techniques and things that we might use with our cattle. Also go into some of the very common, we call it endemic, but it's common diseases that occur on cattle operations. And then steps to actually take as soon as you see some of these changes in our animals. And that's where it's a good idea, and it's good to understand that cattle are a prey species. That means, they're a food animal. Because of that, they act very differently than the way people do. Cattle they would try to hide anything that is bothering them. So if they're sick, if they don't feel good, if they're, if their foot hurts and they don't want to move and they're lame, they don't want to show us those because they're a prey species. So because they're so good at hiding all of these symptoms, it's really important for us, the caretakers of our animals, to be very observant, to really pinpoint when we see them every single day, that's normal, right? We see their normal behavior. We see when they come up to the feed bucket. We see when they walk around and we're able to observe them in movement and eating, that everything looks normal. But when something looks abnormal, whether that's the behavior, whether it's how hungry they are, all of a sudden we have a calf that all it wants to do is eat, and it doesn't come up for the food bucket, the next day. Those are all important things that we need to really keep an eye on, that when we see these instances and these changes that are abnormal, it should jump out at us, and then we need to take added steps to make sure that we take care of our animals the best we can. But before we get to some of the critical parts, cattle health really starts with having a plan. And I think that plan starts at the term is biosecurity. And biosecurity is really just protecting our animals, protecting our herds from any introduction of disease. And introduction of illness can come in from a lot of different places, but it all starts with having that plan and working with your local veterinarian. I'm giving you the overview, but when you need specifics, it's very important to work with your local veterinarian that understands your animals, can give you direct recommendations on specific products to use, but also be there when if something happens, if there's an illness, if there's something that happens, you have that good relationship with your veterinarian that you can always call. Now, part of the biosecurity plan, the preventative plan, might include vaccines. We'll talk a little bit about vaccines and what they do to help prevent and help build protection against some of the common diseases that we have. But it's also about recording, right? It's very important to maintain health records on all your animals, products that you may have administered, when you administered those products, what the withdrawal times are, whether for meat or for milk. And all of those are very important to document when and how you administer different animal health products. And then obviously monitoring our animals every single day. Now, some of the basics of biosecurity, whenever you may be taking animals to, say, a competition or a show or the fair, right? It's good to make sure that we implement these biosecurity principles even when you go to these locations. Avoid contact with other individuals' animals, okay? You're there with your animal, and keep in mind that us, people, when we come in contact with other animals, we can inadvertently introduce disease into our own. So making sure that we keep animals separate, making sure that we don't have nose-to-nose contact, we don't tie them up against the same fence where they can lick and groom each other, especially if they came from different operations. So whenever you go to some of these locations, making sure we're not sharing feed and water bowls, that we are watering our animals not in a shared area, but out of their own bucket from home, making sure they're eating out of the same buckets and water troughs, that type of environment, keeping everything separate when you're at those fairs. Now let's get into some basic recommendations on the vaccines, right? Vaccines are discussed and talked about quite a bit, and there are some very commonly found diseases that we do vaccinate cattle for, whether calves or cows, for basic herd protection. And why we vaccinate for some of these specifics is because they're so common in the environment that our animals can be exposed even without other animals around. Whether it's a fence line contact from a neighbor, whether it's actually lives in the soil. And some of these disease-causing agents can live in the soil. So one thing that's commonly talked about is blackleg. That's what's commonly referred to, but it's a clostridial vaccine, and it may be referred to as a 7-way or an 8-way. And these products are they're used commonly. They're very cheap. They're very efficacious. They work very well at building defenses for our animals. But those are our basic clostridial vaccine. And clostridials, they do live in the soil, so they're found all over the United States, all over the world. So this is a common product that we'll administer to our animals. Now, one point of caution: if you commonly give a quote unquote blackleg or a clostridial vaccine, if you are going to have some management, do some management surgeries such as castration or dehorning or anything like that, make sure that we include tetanus. We talk about tetanus with people. People get tetanus shots and tetanus vaccines to help protect. Well, that same tetanus can impact our animals. So we want to make sure that if we do have one of those surgical management procedures done, is making sure that we include tetanus along with that, along with the other clostridials, especially for those animals that are having that done. The next commonly referred to vaccine for cattle is we call it 5-ways. It's a 5-way viral. There's a set of viruses that directly impact cattle. And those viruses can cause everything from respiratory disease and pneumonia in younger calves, all the way to reproductive issues in cows and mature cows. So they are commonly found in cattle. They circulate through the populations. And these are common viral products that we administer to our animals as a herd basis to help give some basic protection. Now, those respiratory viruses, you read the bottle, usually they're referred to as IBR, which is it's bovine rhinotracheitis, BVD, it's viral diarrhea virus, and BRSV and PI3. So those are kind of the main 4, but there are 2 different types of BVD. So we refer to it as a 5-way viral. And there are different products that are on the market. All have been built, and they're safe, they're effective. But it is important that we're using those products for overall protection, both for the calves and the cows. When we get into calves, it's cows and calves. The basic clostridial, the basic 5-way, that's good for just about every operation. But when we look at specific, if we're just going to raise calves, or we're just going to have a cow-calf pair, and we have different concerns. That young growing calf, after weaning, if we're taking it to, say, a market animal, that animal has different risk opposed to our mature breeding cow. Okay, and the main risk there is our developing, our freshly weaned calf that we're going to take to market. The biggest concern is respiratory disease. Okay, so calf pneumonia, we call it shipping fever, call it BRD, bovine respiratory disease. And yes, it can be triggered by viruses, but there's also a bacteria that we are very concerned about. The word is actually Mannheimia hemolytica, but it's always referred to as Pasteurella. And so, some of our calf vaccines may include that Pasteurella to give that extra protection against that bacteria. Now that's for growing calves, but then for our cows, we have different threats as well. Not our mature animals, we're not as concerned about pneumonia. We are concerned about protecting reproduction, protecting pregnancy. And there are different environmental diseases that they can be exposed to that are commonly found. So that's why we try to give vaccines to help protect that pregnancy even before the pregnancy begins. And those reproductive vaccines would be referred to as lepto and vibrio. Lepto and vibrio. Lepto is commonly found in the environment, can actually be spread by wildlife. So that's why we include it in some of our basic herd protection for our mature cows. Some of the specialized vaccines, if you're going to be taking or selling heifers crossing state lines. You need health papers. Maybe you're selling animals to a different state. There are some requirements that are still put into place that may require a heifer to be bangs vaccinated as a young heifer before it becomes mature. And that bangs vaccine is actually to protect against brucellosis. Thankfully, in the United States, we don't have brucellosis in our domestic cattle, but it is still harbored in some of our wildlife species around Yellowstone with bison and elk. So there's still a threat, and for some of the interstate movements, sometimes a bangs vaccine is required for moving a breeding female from one location to another. So that's something that you would have to talk with your local veterinarian about to see if that's something that should be included in your heifer project. So that's kind of the basics of different things that are out there. Now let's target it into cows and calves. When do we vaccinate? We're going to use some of these different products. When's the best time, and what are we trying to protect against? Remember, with our mature cows, we're protecting against protecting against reproductive issues. Okay, we're protecting pregnancy. So in order to have protection for that pregnancy, our best bang for the buck is to actually vaccinate these cows prior to breeding, prior to pregnancy, so we can build protection even at the very early amounts of pregnancy. So pre-breeding is the most recommended time to be able to vaccinate these cows. Obviously, that's usually about a month or so prior to any type of breeding program. The other time that we could potentially vaccinate is maybe at pregnancy diagnosis. We can preg check these cows to make sure, one, they're pregnant, two, making sure that, when did they breed? When should I expect her to calve? And that would be accomplished by your veterinarian, that we could do a preg check. And sometimes we may booster the cow because we already have her. Okay, it's a good management time that if we have to administer something, we already may have her in the chute. If there's anything else, we could obviously give it a preg check. But the whole scheme is to protect pregnancy. The IBR, the BVD, those virals, maybe a clostridial, but really the Vibrio lepto are very important for those cows, those breeding animals. Now, difference is calves. Right? Remember, the main concern is respiratory disease, is pneumonia in the lungs. But again, the calf has a developing immune system, just like all of us had. Whenever we were young, maybe we got sick more than what we do as you get older, as you're just building and strengthening an immune system. Now, that newborn calf is born with a fully functional immune system, but it's pretty weak. It doesn't have the protection that its mother has. So really, we may start a vaccine program for baby calves as early as about a month of age. But in reality, we may start vaccinating about 3 to 4 months of age for a first round of vaccinations for a young calf, and then follow with, and we refer to that as branding time. So we may vaccinate at branding time at 3 to 4 months of age, and then wait until just before weaning, because we traditionally wean, when they're 6 to 7 to 8 months of age, and we'll wean that calf and separate the calf from its mother. That's a stressful time. So we try to build protection against some of these pathogens prior to those events. So as you can see in this slide is, when do we vaccinate? The first time for a young developing calf would be branding. The second time would generally either be pre-weaning, about a month prior to your scheduled wean date, or at weaning. Okay, so those animals have 2 rounds, and that second one is very important. It's considered a booster. We get good lasting protection after that booster. Now, once we've gone through that program, we've really set up that calf for success, making sure that we have 2 rounds of vaccinations prior to that weaning. And then if you maybe bought a weaned calf and you're unsure about the vaccine status, we may vaccinate that animal as soon as you buy it, to make sure that we are ensuring that protection that's long lasting for as long as you're going to have that animal. And again, the most common is we're concerned about respiratory disease, or 5-way viral. Maybe we include some of that bacterin, that Pasteurella, but also our basic clostridials. And remember, don't forget about tetanus, because not all 7 ways have that tetanus included. Okay, so that's a basic herd health protection, what we're concerned against, our common vaccines that are available. Now let's go into some of our common health issues that most operations see at some point in time or another. Let's talk about a couple circumstances that are considered emergency, that you would contact somebody immediately, and I've got some pictures to go along with it to help visualize what these different circumstances or the behavior of our animals, how they may change. The first one I'll cover is some basic skin issues. These are very visual. We know what normal hair looks like. We know what the hide looks like on our animals. Everything is smooth and kind of the pristine sheen that we will see on some of our cattle. But there are some circumstances where it doesn't look so normal. And the first of which are warts, right? Warts are common in all species. People can get warts, cattle can get warts. In cattle, it's actually caused by a specific virus that only affects cattle, and that the virus it's found all over the place. And it doesn't cause any direct harm to cattle other than these ugly, crusty lesions. It is considered infectious because it is caused by a virus. It's a stomatitis virus. So usually wart issues, especially if they're severe, maybe an animal won't be able to show, won't be accepted into a fair because it could be contagious. But now the good thing with warts is this is a disease of young animals. As their immune system ages, yes, they develop immunity, the warts go away, they battle against it, but it can be quite ugly. This is a picture of an animal with quite a few warts, right? And they're raised, they're crusty, almost look like cauliflower. Those are warts, and many times they resolve on their own. If you have an extreme case like this, or if you have more concerns, your veterinarian may be able to do some extra things to help get rid of some of the wart concerns. But keep in mind, these warts don't directly impact the health or the well-being of the animal. It's more of an external. Just keep in mind, yes, they can spread from one animal to another, just between cattle. People, these warts are not a concern for people. So just keep that in mind. The next common one is ringworm. Okay, ringworms commonly found, and we'll see these little circular areas of hair loss. They might be on the neck, might be on the head. Those are the two most common areas up over the shoulders. And these are actually caused by a fungus, and the fungus is, in the environment, and it is very infectious. And what's different with ringworm is people can get this ringworm. And if you've ever had ringworm, we get these circular lesions. It causes a little bit of discomfort. But yes, that's what's considered zoonotic. That means people can get it from their animals. So when we see these, yes, they're infectious. No, we probably can't show those animals if they have active ringworm issues. And the good thing is they resolve on their own. Just like in people, even with very minimal, just cleaning it up a little bit, it kind of goes through its own course of disease, goes away, and it just takes a little bit for hair to grow back. So ringworm, yes, people can get it. Here's a case of a calf with some pretty severe ringworm lesions that are up over the eyes and the head. And why it's usually on the head and the neck, it's from contact. It's where they rub. So wooden fences or wooden feed bunks, things that they'll constantly rub their head against, are notorious for harboring this fungus, this ringworm fungus. So that's how it spreads from animal to animal. As they go up and rub on a particular post, maybe it's wood, and the next animal comes by and rubs their head and neck up against it, and now all of a sudden they have ringworm. So again, very infectious. People can get it. So if you have an animal with ringworm, make sure you wash your hands, wear gloves whenever you're handling it. So yes, that is ringworm. Moving forward from some of our skin issues that are pretty common, let's talk about some of the other common health ailments we may see, and then kind of the course on what we would do to intervene. Because with warts and with ringworm, they kind of run their own course, where it's not a huge health concern. But the next set of diseases are a big health concern because we can have lasting effects that are very detrimental to the animal. First of which being is pink eye. Pink eye is an eye infection. As you can see, this calf is it's got its eye is squinting shut. It's got all this all this fluid and all this gunk, so to speak, building up below its eye. It's very painful. You'll see it squeezing its eye shut. And it's painful for a couple of reasons. It's very sensitive to the wind and the sunlight because there's actual damage on that eye. So they'll be blinking, they'll be tearing. It is a painful condition. It can lead to an ulcer, which is actually an erosion of the clear area of your eye. That can cause a major, major infection if that gets on the inside of the eye. So work with your veterinarian. When you see some of these issues that looks like pink eye, we have squinting, we have tearing, it's painful, whatever the cause, whether it's they scrape, got a piece of grass seed stuck on the inside of the eye, under the eyelid, whatever the direct cause, we know bacteria are in and around the eye. So our main course of treatment is antibiotics. It's injectable antibiotics into this animal, gets into the bloodstream, gets to the eye where we need it most. They may also make sure that we get a eye patch, making sure that we can actually glue an eye patch around that eye to help give some, just relief from the wind, from dust, from sunlight, which the sunlight's very irritating for an eye that's already has damage to it. Now, the antibiotic choice, that would be under your veterinarian. Whatever we have, there's a lot of products that are on the market that are labeled and effective for pink eye. So there's not just one product. There are several that could potentially be used, but always using those under the direction of your veterinarian. Now, when we move away from the eye, other issues that commonly happen, whether these are calves or cows, mature cows, is we can have lameness problems. This is where they don't move quite right. They all of a sudden their gait, the way that they move their legs, it doesn't look right. They're limping. They may be packing or holding a leg where they're trying to hobble around on three legs. And there's a number of different causes of lameness that show up in beef cattle. Sorry about that. The first lameness issue is foot rot. Okay, so foot rot is a bacterial infection of the foot itself. Okay, and we actually see the foot kind of break open. We get a breakage of the skin in between the two hooves, and that allows bacteria from the environment to get in. We see swelling. The foot swells out, and it's very painful. It can happen quick, but whenever we treat that animal quickly, gets over it quite well. Joint infection. So this is more of a baby calf issue or a freshly weaned calf issue where we can see joints on the animal that start to swell and they are lame on that joint, whether it's the big joints up on the stifle, could be the lower, the hock, the carpi, all of these different joints could potentially swell and get big. That's actually due to bacteria. So that's a bacteria got into the system and caused some of these joint infections. And then the last one is laminitis. I've got a couple of pictures, and I'll talk a little bit more about laminitis. The picture previous was joint infection, where we see swelling of the joints themselves. This picture on the left is an example of foot rot. That's a true foot rot case. Not all lamenesses are foot rot, but this specific issue is. We see swelling below the dew claws. We can see it bump over in the front. This whole area, the lower part of the foot, is swollen. It would be very lame. It would be gimping along as it moved. So this would be, it's a bacterial issue, and it's located just in the foot, and we can see it because it's swollen. Okay, so that is foot rot. The one on the right, however, is not foot rot. And we can see its stance. This animal's elongated. It's stretched out. Whenever it walks, it's very tender on its front feet. This is known as founder, okay, or laminitis. Could be from a couple of causes. It could be grain overload. And let's talk about a couple of these causes and then what to do about it. So remember, foot rot, the lower swelling in one of those feet, we can isolate it. We know what it is. It is caused by a bacteria, and it responds rapidly whenever we treat these animals early. Again, working with your veterinarian, knowing what products and what they recommend. But again, many products available, just like Pinkeye, that we can utilize on foot rot. When we treat these animals early, they respond rapidly. So they should respond within just a couple of days. The swelling starts to go down. All of a sudden, they're no longer lame. They're very, it feels really good if they have that issue and we treat them appropriately very early in the disease. They get better really quick. Now, if they're non-responsive, that means that you treated them and they didn't get any better. Within a few days, between 3 to 5 days, if they're not almost 100% better, call your veterinarian again. There may be something more sinister or more dangerous, that we have an infection deeper into that foot that needs a little bit further workup. We may have to trim that hoof. We may have to do some different things to be able to get at it. So again, basic foot rot, you treat them early, they should get better really quick. If they don't, make sure you follow up with your veterinarian, because they may have to do something a little bit more to get that animal over that issue. The joint infections, whether it's a baby calf or a freshly weaned calf, and we have that big swollen joint, they can be challenging to treat. It takes a long time to fully recover, but they can. And it's making sure as soon as we see those issues, we get them diagnosed. We make sure we work with our vet, but it does take some time. It could, even take a couple of months to fully recover from some of those instances if they recover fully. Okay, so joint infections aren't fun. Just know that we have swelling up high. We have big joints that are swollen. Early treatment in those is really, really important. Now, the last one, the very sensitive feet and staggered out, laminitis or founder can be caused by a couple of different issues, but usually it's from overeating grain. So in acidosis, they overeat grain. It gets digested really quick. It releases all of this acid inside the rumen itself, and through that acidotic state causes some issues in the rest of the body as well. One of those is founder, and it's similar to founder in horses, where we get separation of the connective tissues inside that hoof. And where it separates a little bit, they get long paddle feet. They walk with their feet out in front of them. There's not a good treatment for those. Once they get foundered, we may be able to hoof trim them a little bit, but it can be permanently damaging for a cow. So making sure that we are feeding them appropriately, making sure that they don't get loose and get into the feed bag, but limiting them to make sure that they are only eating what they should in a very, very consistent time frame. So feed consistency, making sure that we're feeding the same feed at the same time of day, and making sure that they don't get into that period of time where they're super hungry, where they binge feed. Those are all things that we try to avoid, but we want consistency whenever we feed those animals to help prevent some of the things like founder. Next is a true emergency. Okay, bloat. Okay, this is an air bloat. As you can see on this cow, the whole left side, we're staring at it from the back side, and this left belly is just huge. If you went up and pushed on it, you couldn't even push it in. It is so tight. That is a gas bloat, and a gas bloat is an emergency. It can kill the animal. It actually impedes with the animal's ability to breathe. It actually compresses the lungs and where it can no longer pull in air. So bloat is an emergency. We can treat them on farm, but we do have to get that gas off. So if you do see an animal that's bloated, its left side is big and distended, we want to make sure that we contact somebody immediately, somebody that knows how to properly tube this animal, whether that be somebody else, could be a parent, could be a neighbor, could be your veterinarian, whoever that is, to be able to show up as quick as they can to be able to tube that animal. Usually we do it via stomach tube. So we actually take a little piece of pipe and we put it in their mouth, and then we pass a stomach tube all the way down into the rumen, and it just massive amounts of air comes pouring out. Now, just keep in mind, bloat, yes, we can tube off the air, but sometimes that may not be enough, especially if they got, again, overeating grain. If they got very acidotic, sometimes they bloat for a couple days in a row. So we need to be prepared for that. The other circumstance where we can see repeated bloating in the same animal is they actually had respiratory disease. So they got pneumonia at some point in time. And due to that, some of its lymph nodes on the inside are swollen, and it impedes with the nerve control of that rumen. So those are the two circumstances. We had grain overload, or kind of had it secondary to pneumonia. So just because we tube them off once, we need to keep a close eye on those animals to make sure that they don't bloat up again. Okay, but again, don't wait on a bloat. If we see that, it does need to be addressed rapidly because it can quickly turn into a major issue and even lead to death. Okay, next, respiratory disease. I've talked early in our discussion here. I talked a lot about BRD or respiratory disease or pneumonia. Those are all referring to the same issue, and it's a disease of the lungs in some of our growing animals. So prevention, yes, we prevent. We reduce stress. We make sure that feed and water and comfortable area for those animals to always lay down. Those are three key concepts of making sure these animals stay comfortable. Setting up a vaccine program with your veterinarian to make sure that you're using the right products. Remember, we talked about branding and then pre-weaning and maybe on arrival if you purchase that animal. Those are kind of some critical timeframes to help build protection. Now, even with all of that, vaccination programs can always be overrun by some of these issues, whether the animal gets severely stressed, environmental stress from cold or extreme heat. We can run into some of these problems. Now, when you see some of these symptoms, and I'll talk about the symptoms in a second, it is very important to treat as early as possible in the course of disease. Okay, so setting up that treatment, again, with your local veterinarian, I can't stress that enough, to be able to understand when to intervene, how to intervene with what type of product, and then record any type of treatment, just like with any disease. Now, those symptoms that we really look for respiratory disease or pneumonia is it's truly behavioral changes, right? We see them get depressed, right? Their ears are a little bit droopy. They hang their head a little bit lower. They're dopey. That's really what it comes down to, is they just don't look right. They just feel, it looks like they're not feeling well. They may be off of feed or eating less. Maybe they don't clean up all of their feed that day. If we look closer, sometimes the nose is really runny and has green or chunky stuff coming out of the nose. If you look at their breathing, they're really fast-paced breathing, right? Sometimes it will accompany with diarrhea. They can have this really yellow, stinky diarrhea that's usually secondary to fever. So if we do have these animals, one way we can check we can check with a rectal temperature. We can get them into a chute. We can check their internal body temperature. Normal body temperature for a calf is between 101.5 to like 102. If the animal's close to 104, that's spiking a pretty good temperature. So 104 plus is we can be pretty confident that it's respiratory disease. So look for the behavioral changes: depressed, dopey, off feed, coughing, dirty nose, not cleaning their nose, increased respiratory rate where they breathe rapidly, possibly a little bit of loose manure. So all of these coupled together are very common symptoms of bovine respiratory disease. We treat it with antibiotics, usually injectable antibiotics. So working with your vet is very important to make sure we have an early treatment if we get a sick calf. Other unfortunate diseases that pop up occasionally is urinary stones. We call these water bellies. They get a stone that forms and it blocks their ability to be able to urinate. More commonly seen in steers, lesser so in heifers. We usually don't see this issue in heifers. But yes, it's a major issue. We see animals straining. It's usually steers on a high grain ration that are growing rapidly. All of a sudden they become super uncomfortable. They'll be straining, they'll stretch out. They may hike their tailhead consistently. These are all symptoms of they're trying to urinate, but they can't. Their bladder just gets bigger and bigger and causes a lot of straining, a lot of pressure. Contact your veterinarian immediately. These are circumstances a surgery would actually have to be performed to fix this, where we can relieve that urine, be able to make sure the animal can still urinate into the future. They do surprisingly well after the surgery. So this is one that if you see this, either we have all this straining, it's either absolutely a urinary stone or a water belly, or they have a disruption inside their intestines. Regardless, you need to call your vet when you see this consistent straining, especially in a steer. Since we've talked a little bit about diarrhea and things like that, especially for growing calves, for our market animals, or even our young calves that are out with cow-calf pairs and the weather starts changing, we may see a little bit of bloody diarrhea. And there's little specks of blood in regular looking manure. That would be, it's called coccidiosis. Okay, so coccidia are generally carried in about all of our cows. All of our calves have been exposed, usually early in life, and they carry some level of cocci or coccidiosis. They carry this protozoal parasite in their intestinal tract. Now, for a healthy animal that's unstressed, they may never have any symptoms. But for an animal that maybe was recently stressed, maybe you recently transported the animal, the temperature changed rapidly. Here in Kansas, we get a 40-degree temperature swing. It puts some undue stress on that animal, where all of a sudden they may break with some of this coccidiosis. We'll see blood in the manure, and many times it's just little specks that are in the manure, but they will be straining. So they'll be constantly trying to defecate to pass manure, and you'll see then their tailhead will be up, they'll be straining. Whenever you see this, we know exactly what it is. Veterinarians, you call your vet, oh, it's cocci, and we've got a couple different options to be able to treat those individuals or treat an entire pen. Because remember, we may have multiple animals with cocci. There are some preventative products that can be fed to animals. There are some treatment products that can be given straight to the animal or maybe put in water. So there's a lot of options that are out there when it comes to coccidiosis control, because it is so common, and we have to have that understanding. They're all carrying that that protozoa. It's just a matter of time keeping the stress levels low so they don't break with these issues. But if they do, we do have good treatments for them. I mentioned parasite, protozoal parasite. Let's talk about some other parasites that are commonly found in cattle that are all over the place, regardless of the type of operation. There's a lot of different parasites that can impact the health and well-being of our animals, and let's go through a couple of those. I think the first one I can bring up is lice, right? Lice is a winter issue, okay? I do want to point out, before anybody gets concerned about, their animals having lice, lice are species specific. So cattle have their own lice. They don't impact people. So if your animals have lice, don't worry about getting it yourself. You're not going to carry that. So lice are just, cattle louse is just on cattle. So it can't impact people. Now, lice in cattle, it is a wintertime issue. So those lice, their populations really like to thrive when it's cool outside. Cattle are grouped together. They can spread them around and share them. But it's a December to March issue that we see most of the impacts of lice here in Kansas. Now you can see kind of the picture on the top right, where we have patchy hair loss in the lower back legs. Sometimes we'll have patchy hair loss on the neck, the top of the back, up on the brisket area, up on the chest. Any place that these animals can rub against is where we'll see the patchy hair loss. It's very itchy. Doesn't cause any major internal issues, but we can cause massive hair loss, a lot of damage to our fences and corrals. So this is one of those diseases, it causes kind of a management issue, because they may be rubbing off on fences and breaking fence posts because they're rubbing so hard. So when we see any of these parasite issues, patchy hair loss, early treatment's very important to make sure that it doesn't get to that extreme point where they're really tearing up our facilities because they're so itchy. A couple of different types of treatments. We have systemic treatments where we can put pour-ons or injectable. We even have topical products so we can pour down the backside that are targeted really specific against lice. So regardless of what that product is, some of them work by contact. Some of them work, they work systemically or get into the bloodstream. If you're using the most common topical treatment products, make sure that we get complete coverage on that animal because they work by contact. That drug, that parasiticide, has to come in contact where those lice are. So many times, if you read the label, it says all the way down the top line, because those products actually it uses gravity and it gets into the oils of the hair and comes all the way down and encompasses the animal. So they are formulated that way. So if you're using a topical product, many times we go from the face, a little bit on the forehead, and then we go from the top of the head, the poll, all the way to the tail head. We have to get coverage on that entire animal to make sure that we get a good treatment and a good protection on those animals. Some of the products are really low dose, so that's why we may have to, it may only be 20 cc's, 20 milliliters, but we have to spread that out over the entire animal. If you have multiple animals within your operation, make sure you treat all of them. So it doesn't matter if you have a herd of 1 or a herd of 100, we want to treat them as a group. Because we know that some animals will be carriers and won't show any signs of hair loss. So new animals, or if you miss one, that could reinfect the entire herd. So we want to make sure that we treat all animals within the group to make sure we're not getting reinfection. And also with reinfection, there's only a couple products on the market that you don't have to retreat. So read the labels on whatever product you're using against lice. Because if you need to retreat them in 14 days, the reason for that is you treat them and you kill all the adult lice, but then all the nits, all the eggs, they hatch out in 14 days and become adults. So you actually have to go back in and wipe all those out. Some of them are long enough acting that you don't have to worry about that. But just some treatment tips for lice. Lice is very common, impacts almost all of our herds in Kansas. Some of our other externals, but this would be more in the summer months. Flies, and a couple of different types of flies. We have horn flies that you'll see flying up all over the withers in the back. We have stable flies that will fly around and bite the lower legs. Super painful bite if you've ever been out in the corral or working with cattle. And if you've ever been bit by one of these little flies, they look like house flies. They're very small like that, but boy, they pack a punch. They are a very painful bite, and that's where we'll see our animals stomping their legs, swishing their tails, pacing around. Many times that's from stable flies. Grazing animals, we may see some tick issues and things like that. But regardless of our external parasite issue, or flies or ticks, usually we treat them and control them the same way. And I'll talk a little bit about those because there are many options. We have feed-through products, so we can put in the mineral or the feed to be able to help with control of some of those. We may use some ear tags that are impregnated ear tags with the insecticide. One key part of using the ear tags is read the label. They may be good up to 5 months, but after that 5-month period, make sure you remove those ear tags and get them off the animal and dispose of them like you should. Pour-ons, sprays, those are just topical sprays, maybe even rubs, cattle rubs, oilers and dusters for cattle self-apply some of these products. We do have a few injectable products and even a vet gun. It's a paintball gun with insecticide in it. So lots of options available. Just understand that all of these are still after the same control, and there are different types of chemicals. So work with your vet. I know sometimes we do want to rotate these classes, so if you're concerned about resistance, but those are conversations with your vet to make sure that, and you'll have your records from the year prior, so you know what you used in the past, what do we need to use this year, and having that in place and having it ready to go. Because fly season, here we are, it's February. Fly season really starts to kick in, and they start to come out of dormancy in about April. So as the grass starts to green up, that's when we start getting flies back. A part of fly control is environmental control, especially if you're feeding out animals or you have some market animals and you'll be feeding them in more of a dry lot scenario or in a barn. Whenever we have leftover organic material, whether it's undisturbed manure or spilled feed, things like that. That's where some of these flies, especially stable flies, love to thrive. So bale rings, up along fences, spilled feed, cleanliness and environmental control is really, really important when it comes to fly control. So anything that we can do to disturb these areas, work them up, to pile them, to compost it, to sweep up spilled feed, all of these are very important pieces of overall fly control. So it's all back to the basics. Cleanliness and care really goes a long way. A little bit about internal parasites. Talked about externals, talked about lice and flies, but also worms, right? Internal parasites. Internal parasites are interesting. All cattle, just about all cattle are impacted in one way or another by internal parasites. They actually pick up these worms as they graze grass. So the pastures can, if the pasture has ever had cattle in it, they're going to graze. They're going to pick up worms during the summer months, gets into their intestinal tract. When those worms become adults, they shed eggs. And those eggs are super resistant in the environment. So they get passed out into the manure. Those eggs lay dormant until the environment is right. They have enough moisture and the temperature is correct. And these little larvae leave the fecal pat and they go up on grass themselves. Those little larvae move away from the fecal pat and then they go up into little water droplets on the grass. The next animal comes by and grazes those off. It takes about 21 days to complete that cycle, but it's just keep in mind, most of the worm population is not in our animals. It's laying and waiting out in the pasture. So we may have to change some of our grazing management, making sure we don't overgraze, right? The closer cattle have to graze down to the ground, the more likely they are to pick up parasites. Here in Kansas, the worms kind of go dormant and we don't really have reinfection during the winter months, but it's during spring and summer and into the fall is where we have transmission of these internal parasites. Okay. So some of the deworming products that we have available to help control, other than grazing management, okay, we have porons that we put down the back. That it's commonly avermectins or ivermectin type products. We have injectables. We even have orals where we can administer as a paste or a drench. There's some products we can even put into the feed to make sure that we're killing these internal parasites. But as with everything that we've talked about today, work with your veterinarian, your grazing management. I can't give a blanket deworming recommendation for everybody because everybody's a little bit different on their operation. Timing in general, it depends on the type or the group of animals. If it's a mature cow, she's probably built up some immunity already to some of these internal parasites. She may not need deworm very much. Maybe once a year, maybe around calving to make sure she doesn't shed as much. Because with the internal parasites, they follow hormones, right? So whenever cows get really close to calving, they actually start to shed more eggs, more of those parasites into the environment. So maybe that's a good time to deworm your cow. Bulls and growing calves, they don't have much protection. So usually we're trying to protect those breeding bulls twice a year. Our young calves, we get them close to weaning and all the way through. Maybe we're deworming them, and especially if they've been grazing about twice a year. Now, if you're finishing cattle in a dry lot, if they're not exposed to grazing environment, keep in mind they have to graze to get reinfected with internal parasites. So if they're in a dry lot or if they're in a feedlot, there's no more worms that can go in. It's only what they brought in with them. So if you dewormed them whenever you brought them into a dry lot, they have no more exposure. So that's one good thing about internal parasites is we can modify the environment to make sure they're not getting reinfected. So I mentioned working with a veterinarian many times, and I want to give everybody just a heads up that we do have some more legislation, some more rules from the government coming down. And it really impacts all of us, anybody that works with cattle. It impacts us on product usage. So the new regulation beginning in June, okay, so I think it's the middle of June that this takes it goes into practice. All injectable medically important antibiotics are going to be prescription for cattle. Okay. Now that doesn't, that may not be an issue for any of you. If you work closely with your veterinarian, you already have that working relationship called a veterinary client-patient relationship. You can get prescription products from them. They've been to your operation. They understand you've got a good working relationship. This is no big deal. For those of you that may not be working with the local veterinarian right now, you may have been purchasing antibiotics at the feed store or at a farm supply store, something along those lines, where you could still purchase oxytetracycline or LA, LA 100, LA 200, or even penicillins that are injectable that you could buy over the counter. Those products are losing their over the counter status and going to prescription. Okay. Several years ago, there was a similar piece of legislation that went through. It was referred to as the Veterinary Feed Directive, which took all medically important antibiotic use in the feed and put that under veterinary supervision. This is an extension of that rule, where now it's all injectable products. All injectable antibiotics are now under veterinary prescription as well. Okay, so it's been a long time coming. This is I don't want anybody to get caught off guard, and kind of throw that out as a good warning. Now is the time to establish those good working relationships with your veterinarian, because in order to use these control methods, you will need to have a relationship with them now and into the future. So just to finish up, hope you picked up a few tidbits and pieces here. Again, establish that good working relationship with your local vet. There's so much knowledge locally that you have with your own practitioner. Number two is be observant. Remember, cattle are a prey species. We're looking for abnormal whenever we're dealing with cattle. And when we see that abnormal and we intervene early, that's when we get excellent success rates on dealing with some of these disease issues. So with that, that's the end of my presentation. Good luck to everybody, and the care and the well-being that you're responsible for with your animals.
Thank you, Dr. Tarpoff. We appreciate you sharing with us today. And for those of you who are watching the recording, we are going to make sure that we provide Dr. Tarpoff's email address, so that if you have additional questions, you can reach out to him. And once again, thank you again for joining us today. And if you have any questions, be sure to reach out.